Hey, welcome. I'm happy you're here. Thanks for coming. I'm Linda Miner, and this channel of mine is called Right Brain Inc. I'm going to be talking about a healthcare payment plan out of our book, Healthcare's Out Sick, Predicting a Cure. This book is by my husband, Dr. Gary Miner, myself, and Dr. Daryl Dean. The method that I'm going to be talking about today, which is really a cool method, is called Direct Care, Direct Pay. And I'm going to try to go through this thing all at once, and I'll probably make mistakes, and you might hear some background noises. But hey, this is my first podcast, so I hope you enjoy it, but nonetheless, it's going. We really believe that you should be the CEO of your own health care. If you take care of yourself and, do the healthy things, you're going to have less illness and probably visit the doctor less, and healthcare costs will be less. So it's a good thing to really take care of yourself. That's a basic theme of the book, by the way. However, this is my disclaimer. We've really tried hard to make credible information in the book and to have good authoritative references, but we can't really be responsible for your own healthcare decisions. You're going to have to make those yourself, and we can't be responsible for either healthcare or financial decisions. In other words, at the very least, get your healthcare advice from your own healthcare professional. Ideas from this book could be good discussion topics with your doctor, however. Here's a patient talking over her decisions with her physician, and you might even want to get a second opinion and so forth. And do some research yourself. I don't think that hurts at all, because then you can be a collaborator with your doctor. It's a collaboration. Okay. The model that I'm going to present here, I think, is going to be kind of fun and that you might find interesting and maybe even desirable. It's called Direct Care, Direct Pay model. And here's a schematic of it. You see the family that needs care selects their doctor, gets their health care from the clinic, and then when they're finished, there's no copay, there's no sending off things to insurance companies. That's kind of neat, isn't it? Okay, we're going to contrast the traditional method and the direct care method. Traditionally, the costs are hidden, and it's easy for companies to set their own prices as they wish, and then, of course, you have little control over the system, and you take what they give you, and you make it work. Direct pay method is more of an open market, especially as more physicians are starting to use this model. In a free market, the choice of doctor and plan depends on things like your price, the quality of care, how much you think that doctor's good, the number of the patients the doctor has, and supply and demand from the market are in effect here, because if the doctor has too many patients, you may not want to go to that doctor, and so on. In the traditional method, your clinic sends off for payment from your insurance company, and you pay a copay, and sometimes you pay even more. With the direct care method, there's no sending off for a payment. You just pay a subscription to the service, but no copay. A subscription, like a monthly payment. So let's look at this. Actually, this is not true. I was thinking the yearly cost to a family of 4 was $10,000. I believe the cost per individual is $10,000. You need to look that up, and I will too. But anyway, it's a lot. And you have to pay co-pays for visit. Every time you go, you have to pay a copay. And then you have to pay for medications, unless your healthcare plan covers those, which some do, but some don't. And then you have to pay for x-rays and so on. And even if it's your healthcare plan that's paying for those things, you can't tell how much something costs. Honestly. I went once to find out how much an x-ray would cost, and they said, don't worry, your medical pays for it. And I said, but how much does it cost? Doesn't it make a difference to us? Because the more they charge for things, the more insurance gets jacked up. Okay, with the direct pay method, it depends on how much the doctor is asking for a subscription. And of course, if they ask for too much, you don't go to them. But if they ask for a reasonable amount and you like them, then you go to them. I've heard $50 a month for an adult and sometimes $60 a month for an adult and maybe $20 or $30 for a child. So let's say $60 a month for an adult and $30 for a child. The total for your family would be $180 a month or $2,160 per year for your family. And there's no copay for visit. You can get face-to-face. You can get phone calls, emails, texts, sometimes even house calls. House calls, can you imagine that? Oftentimes, generic meds are free or wholesale, and basic tests are usually free or wholesale. Of course, it depends on the doctor because it's like they're running their own business. But there are many, many advantages to that for you and for them. In the traditional method, hospitalization is often included in the plan, but sometimes there's a limit, lifetime limit to how much you can use, and sometimes you get a cap then. The insurance plan tells you where you can go for treatment. No, you can't go to that hospital. You can go to this hospital. Which doctors are available for you when you're trying to pick your primary care physician or your PCP. With the direct pay method, you can buy catastrophic health care insurance, and that's very inexpensive. It's kind of like in the olden days when people would go to the doctor and they paid the doctor for the visit, and then they had hospitalization, the old Blue Cross, Blue Shield kind of thing where they just had hospitalization. That would be like this. You just pay for hospitalization, and it's much cheaper, much, much cheaper. And then if you want to select your plan, you can look at your family history and say, heart disease runs in our family, so I want to make sure I have a plan that includes that, and so on. You can kind of be more in control. You find your own physician, and a lot of people are starting to do this, but it's kind of few and far between at this point, but I think it's going to get more. Here's a site on there at the bottom that you can go and find a doctor who's participating in this. Do you ever worry about how you're going to pay for your hospital bills and your medical bills? Our government probably should. Doctors have, and their staffs have a lot of paperwork with government regulations and so on. It's enough to put them under. I've heard about doctors, if they don't have a scribe or somebody to do this, they've had to go home after a full day's work and click the boxes, do these things that are required of them. They don't have to do that with direct care. And it's cheaper. You get a sale. These are the ways in which you can visit your doctor. You can text. You could go online and send an email. You could go in and visit. And did you know that when you go into a doctor, they've got to have so many people running through at a time? It's almost mandated, and they end up having to spend maybe 5 to 6 minutes with you. And the research shows that after about 15 seconds, they will interrupt when you start telling them what's wrong. They don't have time. And then they got all that paperwork, and they got to send off for stuff. But with direct care, you can talk longer, and you can get your medications and x-rays. And your doctor will look at you because they're not writing in their little tablets. They don't even look at you anymore because they've got to click all the boxes. And it's going to end up with happier doctors. So let's look at the model. Here are the patients. They select their doctor and they subscribe and they pay a low monthly subscription. And then when they need to, they access medical care. They can go to the clinic or they can email or whatever. And sometimes video face-to-face will be a way that could be handled that way too. But there's no visit billing to insurance and no bills for the patients. And you can go 5 times in a month and you still just have your one monthly copay. You know, healthcare in the United States is very complicated at present, and I don't see really that Congress is going to be doing much about it. Maybe they will. I hope so. But anyway, changing everything all at once could be catastrophic for our economy. If they decide they're going to go for a single payer model, my goodness, think of the amount of money it's going to affect our economy. If they keep things as they are, people are not included, and it's kind of hard. Under the direct care method, it's doing it gradually. Doctors are starting to break off. They're starting to just say, no, I'm not going to do that anymore. And they're setting up their own direct pay method. And it's going to be a gradual process, so I don't think it's going to be quite as disruptive if it moves in that direction. And again, subscribers would need to add catastrophic insurance, but it tends to be cheap. Now, the government, I think, should have a role. They should pay the subscription funds for those who are in financial need. You know, maybe there's a cap or something on how much could be paid for people who don't have enough money. But everybody does need health care, and something needs to be done, and the government needs to take care of helping those who cannot help themselves. Okay, be the CEO of your own health. We can be much more responsible for our health, and then we don't need to visit the clinic. This puts healthcare back into the hands of the doctors and the patients. It's really a very pleasant journey, I think. You know, if a doctor is not any good and they ignore you and you're not able to say what you need to say, and you can't get anybody to listen, and that they make wrong decisions and so on. If they're your PCP that's assigned to you by your insurance company, there's not a whole lot you can do. But with this plan, you go to a different doctor. Of course, other doctors could charge more, I suppose. That is free enterprise. But on the other hand, this is a path that can revolutionize healthcare, because doctors can then have more choices. You know, maybe they don't want to work like dogs. Maybe they would like less money and have fewer patients and really have good interactions with those patients. Like in the olden days when you'd go in and your doctor knew who you were. It's really nice to have a doctor who knows who you are, and you don't have to explain everything every time. Here's the book. It has other kinds of methods of payment that are listed in there, plus a lot of other information. And I'll be doing other podcasts on information out of this book. It's called Healthcare's Out Sick, Predicting a Cure, and it's on Amazon. Thank you so much for watching this podcast. Please click the like button if you would, and subscribe to the video and to the channel, and then you'll get information about new podcasts that I have.